Hello, so we're here again for the Dipple PPG, the first one of 2021, hopefully a better year, and there's light at the end of the tunnel. We've got Jill with us, the Heart of Pitsea administrator. We've got our lovely Maggie. Maggie, which surgery are you from?
South Wing Dipple.
South Wing Dipple. And me, Stephanie, Heart of Pitsea coordinator. So what we're going to talk about today is vaccinations and the procedures really, and how you'll be contacted from at least Maggie's surgery, which I'm pretty sure most of the surgeries are the same.
Yes.
So over to you, Maggie.
Right, well, once we have a list from the CCG that targets the cohort that they're doing at the moment, we contact the patients and book them an appointment. At the moment, it's being done at the George Hurd Centre in Basildon. That could change, and hopefully in the next week or two, we'll hear whether or not we're going to be doing them at the surgery as well. The procedure at the George Hurd Centre is generally pretty slick. It's all safe distanced, everybody's wearing masks, your temperature's taken, you go through, they take your name, you're directed to a doctor who goes through your medical history. You then go through to a clinician who gives you the jab. You're sent over to another area separate from that where you sit for 15 minutes, and then once your time's up, you check out at the reception desk and go out the opposite way to the way you came in.
What's the waiting procedure? Why is there the wait at the end, Maggie?
In case you have any problems once you've had the jab. Some people can be a bit sensitive to it.
Cool.
So you just wait 15 minutes, and if you feel fine, off you go.
We heard it was a bit busy down there last night. Was that just?
No, it was bedlam. Was
it the first day of the vaccination?
No, not at all. They've been going for a few weeks now. I don't know what happened last night. Everybody in the queue was saying they were booked in at 6:30, and the queue stretched back into Audley Way, right the way around the car park at the George Hurd and into Audley Way. There must have been 300 people queuing.
Wow.
My daughter's appointment was 6:30, and she got seen at 8:05, and it was freezing cold.
But that's not been happening.
That's not the norm.
No, that's good.
We don't know what happened last night, but generally it's very slick. And you know, to be fair, once in the building, it was very good.
Oh, that's perfect then. Okay, so it's just a little anomaly then. That's something that's just happened one night. That's perfect. So hopefully it shouldn't happen again, and then everyone will get vaccinated on time. Yeah,
it's usually done very well.
It's not the weather for it, is it? So
no,
just in case, everyone needs to wrap up warm then, is that?
Absolutely, yeah, that's it. Take a flask.
Yeah, take a flask, cup of tea and a book, just in case.
Be prepared.
Oh well, these things happen, don't they? Is there anything else we need to know about or anybody needs to know about the procedures, Maggie, do you think?
I don't think so. I mean, it's pretty straightforward. You know, you're contacted. If you want to have it, you're booked an appointment, and that's pretty much it. The only thing on the subject of vaccinations is we're a bit disappointed about the uptake for the 50 to 64-year-olds general seasonal flu.
Right.
We've got over 800 on our books that fit the criteria, and so far we've got 80 booked.
Really? So you're encouraging people?
We are trying to encourage, but I think in the main they've got it in their heads they want to wait for the COVID vaccination, but it could be a good few months.
Yeah.
And meanwhile, seasonal flu is really quite nasty if you get it, you know, so we are pushing a bit, but so far not good.
So really all normal vaccinations are happening as normal if required, and the COVID jab is just happening in a different location.
Yes.
And just under a different kind of booking procedure.
That's it.
Right,
yeah,
okay.
Exactly that.
Maggie, could you just repeat that age group for the seasonal flu that you're looking to encourage to come along?
50 to 64.
Okay.
Yeah, the last thing the hospitals need is a lot more seasonal flu in there as well, isn't it?
Exactly.
Yeah.
We've had one question about the COVID vaccination. I don't know if you can answer this, Maggie, obviously just for your own surgery. They asked, do you know which vaccine you will which vaccine the patient will be receiving?
At the moment, down at the George Hurd Centre, as far as we're aware, it's the Pfizer.
Mm-hmm.
If we do them here, it will be the Oxford because of the refrigeration.
Yeah, that makes sense. Yeah.
But there's no difference between the vaccines, really, is there?
Not a great deal. The only difference that we know of is the refrigeration part of it.
Okay, so
We
just
can't keep
for-
the Pfizer one in a general vaccination fridge in this surgery, or any surgery really. So
the
it will be
logistics
the Oxford.
is purely logistics on
It is.
the
Yes.
vaccination that you get.
Yeah, as far as we're aware, each is as effective as the other.
Cool. Okay. Perfect. Good. Can't wait to get mine. Get a little bit of life back to normality, I think.
I'll
I
take
have
my
you.
one.
Jealous, Maggie, a little bit jealous.
Sorry.
What I'm thinking, we actually have loads of face masks left. So if any of your patients or anybody wants any, they just need to send me a little text or
Okay.
a little email, and you can get our details on Facebook. Our Facebook Messenger's not working that well at the moment. We can't access messengers. So if anybody tries on that, we're unable to read your messages. So yeah, but we have got a lot of face masks, all free, and we'll get them sent out to people, or post them if you can, you know.
I think you're going to need them for quite a while yet, so that's good to know.
Yeah. And they are washable, so people can reuse them. If people if they have trouble contacting us, they can go onto our website, which is heartofpitsea.co.uk. Just click on the contact us page, and there's a contact form there, and that comes straight through to me. So if anyone needs anything, then that's another way they can get in touch.
Thank you.
Oh, perfect. So has anything else been going on at the Dipple South Wing?
No. Not really. I mean, up until last week, we were doing most things, but obviously with the new lockdown restrictions, we've had to tighten our belts a little bit and limit less routine things, really. So, but we're still seeing patients.
Yeah, so appointment systems are all the same still prior to Christmas. It's telephone appointments, and then you're invited in if need be. Yeah,
it's telephone appointments with GPs, but with nurses and myself, it's face-to-face, most of them.
Okay, yeah, perfect. All right, yeah, well.
It'd be difficult to do blood on a phone, so.
Yeah, it would be, yeah.
But no, other than that, everything's happily, we're quite quiet.
Oh,
you know, no big dramas. So.
But always available if people need you.
Absolutely.
What's important.
Yeah, definitely. Yeah, they need to know that.
Jill, sorry, did you?
Yeah, that's right. I had an email conversation with Hearing Help Essex, and I understand they're coming back to you for more sessions this month.
They are, yes. Yeah.
Yeah. So that what they're saying is that they haven't cancelled any appointments, any sessions, but they haven't got many people coming in at the moment. So
it doesn't matter. They can please themselves, come and go as it suits them. With, doesn't matter to us.
Yeah, but they're just really trying to get people more that need emergency repairs, or rather than just the general routine stuff at the moment because of the lockdown and the numbers. So yeah, so if anyone wants to get their hearing aid fixed, then I think the next one is on the 21st of this month.
I will put a notice up in the foyer, as long as nobody takes it down. We've had a lot of trouble in the foyer lately. We've had the windows smashed in, so they're all boarded up at the moment. I don't know if people think we're closed, but we're not. Can't replace the glass at the minute because it just gets broken again.
Right, so people really need to be aware then. It might look closed, but it's just not. It's open as usual. Well, that's
I mean, it looks a total derelict building, but we're still here.
Still functioning.
Yeah.
Well, I think that's all we had. Jill, did you have anything else for Maggie?
One other thing is that there's an organisation that are offering free, simple to use video connecting devices, a bit like a tablet, and they're giving them away free to the vulnerable and elderly who are isolated and might want to have one to contact their family and friends.
Right.
So I'll send over the information about that. So it's through Essex County Council. So anyone in Essex that's vulnerable or elderly that wants one, they can have one.
That's good to know. Oh, right. Oh, that's good. Yeah, because I think I can't see an end to this for, you know, a good few weeks, and it's a long time for a lot of people, isn't it?
It really is, yeah. Yeah, and there's a lot of homeschooling tips and locations on our Facebook site as well.
Good.
Are they on the website as well, Jill? Yeah, and on the website. So if anybody needs any kind of help or ideas where to get lessons from, they're there. And obviously we still have community counselling hours. So if people are feeling particularly stressed or vulnerable by this situation or require counselling, then they can contact Listening Post if they have to live within our area of funding, but there are free spaces. But Listening Post do subsidised hours anyway, so it depends.
Yeah, and that's for people who work in our area as well.
Yeah.
So
okay,
anyone,
fine.
yeah, so
Good. Well, we're doing okay then.
We are. Grand scheme of things, we really are.
I think so. We've been lucky so far anyway.
we have.
Anyway, I
So-
think that's all we've got. Have you got anything else, Maggie?
No,
Okay.
that's it really. I
I'm
was
just
you know.
going to stop the recording then. We'll see you all on the next Dipple PPG.
All of us.
All of us.